how are you?
I'm doing okay.
My name's Matthew. I'll be your nurse today. We'll be doing a complete head-to-toe assessment on you, which means we'll be listening to your heart, your lung sounds, your bowel sounds, and just checking over your general overall appearance, okay?
Okay.
Everything I do is going to be a safe, if I'm touching you, it'll be a safe touch. So if you have any questions or you don't feel comfortable, you just let me know, okay?
Okay.
Okay, I'm going to go wash my hands now, and I'll be right back. Okay, now that I wash my hands, find a seat. And can I get you to state your name for me?
Casey Stewart.
And your date of birth?
January 3rd, 1990.
Okay. I'm going to start with your vitals, okay?
Okay, that'll be fine.
Both sides. Check your temperature. If you will, just put this under your tongue for me.
Everything looks okay?
Everything is normal so far.
Well, that's good.
I'm going to do your blood pressure now, okay? And we'll bring you up to my level, okay? So it's a little easier. You can relax now. Your blood pressure was 120, 72. You're going to be okay? Wait. To be within normal range.
So nothing to worry about?
Nothing to worry about.
Okay.
Vital signs generally described as the measurement of temperature, pulse, respirations, and blood pressure. Given an immediate picture of a person's current state of health and well-being. Normal baseline vital signs would be temperature of 98.6 orally, blood pressure 120/80, pulse 60 to 100, respirations 12 to 20, and oxygen saturation between 95 and 100%.
Okay, Casey, can I get you to state your name for me, your full name?
Casey Stewart.
And your date of birth?
January 3rd.
Do you know why you're here?
I'm here because I'm sick.
Okay, and where are you?
I'm at the hospital.
Okay. And do you know what today's date is?
Is it October?
It is.
October 2nd,
Okay, and what year?
2014.
Okay, Casey, I'm going to examine your head right now. So I'm going to be looking on your scalp. Okay?
Okay.
When looking at the head, you want to look for scars, lumps, rashes, hair loss, or other lesions. Also look for facial symmetry, involuntary movements, or edema. Palpate to identify any areas of tenderness or deformity.
All right, I'm going to feel for your sinuses. You let me know if you feel any pressure, if anything is painful. Is that okay? I'm going to get you to follow my pen.
Ask the patient to follow your finger with your eyes without moving their head. Check gaze in the 6 cardinal directions. Check conversion by moving your finger toward the bridge of the patient's nose. And pulse during upward and lateral gaze to check for nystagmus. This checks for cranial nerves 3, 4, and 6.
Now I'm just going to check your pupils, okay?
Okay.
It's going to be a little bright, so you ready?
Yeah.
Look straight at me.
PERLA is a common abbreviation that stands for Pupils Equal Round Reactive to Light and Accommodation. The use of this term is so routine that it is often used incorrectly.
I'm just going to check your conjunctiva sacs to make sure that they are pink. All right, and that's normal. You look good. Okay, Casey, I'm going to check you. Casey, I'm going to check you for any allergies.
No.
Have you had any drainage lately?
No drainage.
No. Do you have any headaches?
Every now and then.
Okay.
Nothing too bad.
Awesome. I'm just going to take a look at your nose, okay? Everything is clear, so that's good. So what we're going to do is we're going to test your sense of smell. So I'm going to get you to close your eyes for me. All right? And when you smell it, can you tell me what it is, okay?
Okay. Kind of smells like garlic.
That's what it is.
Testing the sense of smell is the olfactory cranial nerve number 1. Observe for any facial droop or symmetry. Ask patient to do the following. Note any lag, weakness, or asymmetry. Raise eyebrows. Close both eyes to resistance. Smile. Frown. Show teeth. And puff out cheeks. This shows cranial nerve number 7, the facial nerve.
Okay? Just let me know when you hear it, okay?
Okay. I hear it.
This hearing test is performed to locate cranial nerve number 8.
And I'm going to look and I'm going to inspect inside your mouth for any white patches or any just missing teeth or anything like that. So open up your mouth.
Ask the patient to open their mouth using a wooden tongue blade and a good light source.
Put this on your tongue.
Inspect the inside of the patient's mouth, including the buccal folds and under the tongue. Note any ulcers, white patches, or other lesions. If abnormalities are discovered, use a gloved finger to palpate the interior structures and flora of the mouth. Inspect the posterior oropharynx by depressing the tongue and asking the patient to say "ah." Note any tonsillar enlargement, redness, or discharge.
Do you wear any dentures?
No.
Okay.
Listen to the patient's voice. Is it hoarse or nasally? Ask patient to swallow.
Okay. And can I get you to swallow for me? Did you have any trouble?
No, it was fine.
This is the vagus nerve cranial nerve number 10. Now observe the tongue as it lies in the mouth. Ask the patient to protrude the tongue.
Stick out your tongue.
Move tongue from side to side. This is cranial nerve number 12, the hypoglossal.
Close your eyes for me. What I'm going to do is stroke a place on your face, and you tell me where you feel it, okay?
Okay.
Close your eyes.
Looks like my forehead. Chin. Nose.
Okay.
This is considered the cranial nerve number 5, trigeminal.
I'm going to just inspect your neck for symmetry, okay?
Okay.
Inspect the neck for asymmetry, scars, or lesions. Palpate the neck to detect any areas of tenderness, deformity, or masses. We will also be checking the carotid. You check one at a time for distension or abnormality in sound, such as a bruit.
We'll inspect your lungs. So I'm going to watch for any symmetry, and then I'm going to listen to your lung sounds. Okay?
Okay.
Can you take a deep breath for me? Looks good.
Inspection.
I'm going to listen to your lungs, okay?
Observe the rate, rhythm, depth, and effort of breathing. Note whether the expiratory phase is prolonged. Listen for obvious abnormal sounds with breathing, such as wheezing, rhonchi, or rels. Observe for retraction and use of accessory muscles. Observe the chest for asymmetry, deformity, or increased anterior-posterior diameter, such as with COPD and barrel-chestedness. Confirm that the trachea is near the midline. When auscultating, use the diaphragm of the stethoscope to auscultate breath sounds. You auscultate from side to side and top to bottom. Compare one side to the other, looking for asymmetry. Note the location and quality of the sound you hear.
And it sounds like your lungs are clear. Okay, so I'm going to listen to your heart sounds, okay? I'm going to lay you down a little bit, okay?
Okay.
Position the patient supine with the head of the bed slightly elevated. Always examine from the patient's right side. In a quiet room is essential. Listen with the diaphragm at the right second intercostal near the sternum, which is called the aortic area. Listen with the diaphragm at the left second intercostal space near the sternum, which is your pulmonic area. Listen with the diaphragm at the left, third, fourth, and fifth intercostal spaces near the sternum. That's your tricuspid area. Listen with the diaphragm at the apex. This is the mitral area. Listen for 1 minute. This is also known as your apical pulse. Heart sounds. S1, S2 are normal. S3 is an extra heart sound. S4 is also an extra heart sound and may be indicative of disease.
Do you perform monthly breast exams?
Not normally. I wasn't sure how to do it.
Okay. Well, I can go over that with you, okay?
Okay.
Okay.
Performing monthly breast exams should be done right after menses or day 4 to 7 of cycle, including raising arms to look for retraction. Press down firmly on the patient's finger or toenail so it blanches. Release the pressure and observe how long it takes for the nail bed to pink up. Capillary refill times greater than 2 to 3 seconds suggest peripheral vascular disease, arterial blockage, heart failure, or shock. Next, we're checking the radial pulses on both sides. If the radial pulse is absent or weak, check the brachial pulses.
And do you have any weakness in your arms?
No.
Can you lift up your arms? Just lift them straight up. Okay. Put them down. Pull them out.
Ask the patient to move each joint through a full range of motion. Note the degree and type, pain, weakness, etc. of any limitation. Note any increased range of motion or instability.
Did you have any pain when you did that?
No.
Okay. Let me get you to grab my fingers.
Always compare with the other side. Proceed to passive range of motion if abnormalities are found.
Or push down on my arms. Okay, Casey. I'm going to listen to your bowel sounds, okay?
Okay.
I'm going to lift up your shirt a little bit. Is that okay?
Alright.
When assessing, start in the right lower quadrant over the ileocecal valve. The patient should have an empty bladder. The patient should be lying supine on the exam table and appropriately draped. The examination room must be quiet. To perform adequate auscultation, watch the patient's face for signs of discomfort during the examination. Look for scars, striae, hernias, vascular changes, lesions, or rashes. Look for movement associated with peristalsis or pulsation. Note the abdominal contour. Is it flat, distended, rounded, etc.?
All 4 of your quadrants were active, which is a good thing. And can you tell me when your last bowel movement was?
It was this morning.
Good. Okay. And I just want to assess, have you had any urinary frequency lately?
No, not normally. I mean, if I have a lot of water, then yes, but it's not normal for me to have a lot of urination.
Okay. And have you noticed any changes in your urine?
No.
Okay. No discharge, no odor?
No.
Okay. When was your last period?
It's about 2 weeks ago. I
Okay.
don't know the day. So.
It's okay. And do you see your gynecologist regularly?
I try to. About once a year.
Good.
Next, we check the pulses in the femoral, which is the groin, as well as the popliteal, which is behind the knees, along with the posterior tibia, which is back of the leg near the Achilles tendon, and the dorsal pedalis, top of the foot, and requires a light touch. We will also check active range of motion in the lower extremities. As well as capillary refill in the lower extremities.
Do you
Checking for pain in calves or warmness can be a sign of a DVT.
Okay.
Can I get you to roll over on your side for me? Over this way. Okay. I'm just checking for all of your...
While assessing the back, check for pressure points on the bony prominences. Also checking for hemorrhoids or ulcer-like lesions that can happen from being in the bed.
No.
Alright, and then also we're going to check for the posterior chest, listening to the lung sounds. Oscillate from side to side, top to bottom. Omit the areas covered by the scapula. Compare one side to the other, looking for asymmetry. Note the location and quality of sounds you hear.
And your lungs are very clear.
Oh, good.
Now I'm going to have you to sit on the end of the bed. Over your eye.
From behind, look for atrophy or asymmetry of the trapezius muscles. Ask patient to shrug shoulders against resistance. Ask patient to turn their head against resistance. Watch and palpate the sternomastoid muscle on the opposite side. This is cranial nerve number 11, called the spinal accessory.
Okay, and can you close your eyes for me? Let me see your hand. Can you describe what's in your hand for me?
It's kind of soft and spongy. Kind of feels like a cotton ball.
Okay. And on your other side, can you describe this for me?
It's cold and hard and kind of smooth.
Okay. Good job.
These is called the cranial nerve abducens.
Okay, I'm going to test your gait and see how you walk. Can you walk towards me?
Alright.
Okay, it's normal. I'm going to also test your vision. So if I could get you to stand right here for me. Awesome.
Okay.
All right, and if you would, do you wear any contacts or glasses?
No.
Okay. What I'm going to do is get you to cover one of your eyes, and then I'm going to point to these letters, and you can tell me if you can read them. Okay?
Okay.
You ready?
Yeah. FP. LPED.
Just let me know when you can't read them anymore, okay?
Okay. PECFD.
Allow the patient to use their glasses or contact lenses if available.
CFD.
You are interested in the patient's best corrective vision. Position the patient 20 feet in front of the Snellen eye chart. Have the patient cover one eye at a time with an opaque card. Ask the patient to read progressively, smaller letters until they can go no further. Record the smallest line the patient read successfully. Repeat with the other eye. This is considered the optic cranial nerve number 2. It tests the sensory nerve for vision.
Okay, so Casey, I'm going to walk you back to your bed, okay?
Okay.
Okay, come on. All right, Casey. Can you tell me if you're in any pain right now?
I'm in a little bit of pain.
Okay. On a scale from 0 to 10, what would you rate it?
About a 3.
About a 3? Okay. And what would you like your goal to be for your pain level?
About a 1.
Okay, Casey, I'm going to make sure you have your call bell. It's right here, so if you do need me, you can call me, okay?
Okay.
Awesome.
Thank you.
Uh-huh.